Welcome viewers on MuniMeterHealth, your source of learning about the human heart and cardiology. We are enhancing medical education, patient education, one step at a time in every discussion that we do to improve the clinical outcomes. Very briefly, today we're going to be talking about what are ARB-like drugs or ARB drugs. Basically, ARB stands for angiotensin receptor blockading drugs. So ARBs are actually blocking the angiotensin agent, angiotensin 2, before it attaches to the receptor. So remember, angiotensin 1, as we discussed on a previous video, is converted into angiotensin 2 with the presence of ACE, called the ACE enzyme, the angiotensin converting enzyme. Now, angiotensin 2 is later on acting on a receptor. And remember that. And these receptors are either in the arterioles, which is the target organ where angiotensin 2 will predominantly work. Angiotensin 2 will predominantly work. Angioreceptors arterioles, or they are in the kidneys, or they are in the heart. So we have demonstrated all these receptors, and as a result, the ARB drugs will actually work. ARB drugs will actually receptor blockading drug, and they will block this action right here at this level. Remember, when we discussed the ACE inhibition, they were blocking at this level because the ACE was formed, but angiotensin 1 to 2 conversion was not happening. So that's where the ACE inhibition was happening. But here the ARBs are working at this level, where angiotensin 2 is not getting attached to these receptors. Okay, so the action is pretty much the same, because angiotensin 2, what does it do? It is twofold in action. One, it causes sodium and water retention, as we all know, and it also causes a vasoconstriction. Remember, angiotensin 2 is the world's most powerful vasoconstrictor that you can think of. So being a vessel here like this, what it'll do is it causes vasoconstriction. As a result, there is a narrowing of the vessel, and the peripheral vascular resistance therefore rises. Now here the sodium and water is rising. So both these mechanisms are detrimental in a setting where somebody has hypertension, somebody has had a heart attack, we call it an MI, somebody who's had a heart failure, or somebody who has diabetes and mellitus, and of course has prone for chronic kidney diseases. So therefore, these 4 conditions form the primary indications for using these groups of drugs called ARB drugs, angiotensin receptor blockading drugs. Okay, so hypertension obviously will be relieved because there's less of sodium retention and water retention that will occur. Vasoconstriction will also be reduced. Heart failure, of course, will be relieved because now the heart can pump against lesser peripheral vascular resistance. So the heart will not require as forceful a pump, because you know in heart failure patients the heart is as such so weak to begin with. So now if you have a peripheral vascular resistance which is reduced because of these groups of drugs, the chances are the heart failure patients will only get better. Remember, they have been shown by clinical trials and multiple number of studies that they can prolong life, and they are also of course life-saving drugs as well. So they not only lengthen the longevity of the person, but also they are life-saving in several respects, especially so if they have been used with other class of drugs, which commonly they are in a setting in cardiology. Okay, so ARB, this was a very, very short nutshell, that they work at the level after the angiotensin 2 that has formed, so that the receptor blockading action occurs right here at this level. ACE inhibition works at this level where angiotensin 1 to 2 is not being converted because the ACE is getting inhibited. So both drugs are pretty much very similar, except here the ARBs will work a step further up from angiotensin converting enzyme inhibition. Okay, hope you enjoyed this session, and looking forward to seeing you again on MuniMeterHealth, your favorite site to learn more about